my name is Sarah Williams and I'm a grade 8 student at John William Boyd Public School. My project is titled The X-Ray Gs. I wanted to create these glasses because the current X-ray process can be time, money, and space consuming. With the X-Ray Gs, it's an efficient, cheaper, and eco-friendlier way to examine through the human body and now detect concussions. X-rays have been around for many years now, dating all the way back to 1895. They are used to identify bone fractures and breaks, and even dental problems such as loose teeth. Believe it or not, X-rays are able to detect complications with our body like scoliosis, issues with the lungs, heart problems, and even certain types of cancer. Sure, these X-ray machines can detect many issues within our body, but have you noticed not one of them includes one of the most important parts of our body? The brain. To no extent has one of these inventions been able to detect concussions. Not to mention how inconvenient X-rays can be, having to wait hours on end just to be seen by the radiologist, but consuming so much space as well. The X-ray Gs are lightweight and portable X-ray glasses that are able to free up hospital rooms while also being used to identify head injuries such as concussions like I mentioned, meanwhile being green and eco-friendly in it all. If glasses with X-ray vision identifying bone fractures and breaks were successfully to be created, then serious injuries will be identified in a more efficient, cost-effective, and space-minimizing way, while also being able to solve so many other problems. If these glasses are able to profitably take off, then all hospital spaces will have access to more rooms for patients who really need the rooms rather than concussions, which take up so much space in hospitals. Something that worked well, I think, when I was creating my prototype here, as you can see with the pictures, is the buttons and being able to envision how the real X-ray Gs would look and function, being able to have that look of the real prototype here. So you have a Bluetooth button, a camera button, an on and an off button, as well as a picture inside the bottom of the glasses here, which would identify showing you a broken bone. Something that I think that could be worked on for next time, and a factor that could be improved, is having something to extend the picture outwards so you have a better overview of the X-ray instead of being able to, when you put them on, just having a black vision because it's too close to the human eye. Looking back and analyzing the data, there are positive benefits as well as negatives and critiques to improve. Majority of Mr. Mifsid's grade 8 class, which is my class, agreed the X-ray Gs could be a space-minimizing and beneficial pair of glasses for hospitals and doctors, as well as 95.2%, 20 out of 21 participants agreed it could be an effective invention. Relying on the data, the X-ray Gs would be a big hit due to the X-rays being so compact and small, being able to take them anywhere and being so portable and easy accessible, instead of loads of unnecessary equipment that huge X-ray machineries use. The data has shown that a possible explanation to why the image goes black, like I said, is because the picture of the broken bone is too close to the human eye, so something to extend outwards, maybe like an arms, would be able to solve that problem. In conclusion, the hypothesis was proven correct. The current X-ray goggles prototype was able to successfully be created. The glasses were able to be a safe spacing, minimizing, an efficient innovation for doctors and hospitals to use, resulting in more rooms to access for patients. Sewer systems can become clean and toxic waste free due to the depletion of chemical fixers and lead foils from X-ray processors. As plastic and silver materials inside X-ray machines end up in landfills when disposed of, which could take up to 1,000 years before they can biodegrade, which causes more issues for the environment. Using similar procedures of CT scans and an MRI, that's how you'd be able to detect concussions with the glasses compared to how X-rays are just not able to detect them today. So using more advanced technology that use like MRIs and CT scans, being able to put that into the glasses and making it more advanced technology. However, there are a few things that can be adjusted for the X-ray G model, such as having a back strap on the glasses here, because mine just had like the foldable sides, being able to fit all doctors, having the one size product. Another thing is fixing the prototype to actually be able to see through the lens, like I said, instead of having a black piece of construction paper covering it, which would be further on improved, and as well as using more an efficient support rather than tape, like maybe hot glue, to reduce the messy look of the X-ray G prototype. On the lens, using a better marker. Here you can see where I used to cover the lens to represent it. Was kind of smudging, making it look unprofessional. This innovation was created specifically for doctors in hospitals, radiologists, or anyone who deals with X-ray procedures. The X-ray Gs were invented for the purpose of being able to have a space-minimizing, eco-friendly, efficient, inexpensive X-ray and alternatives. The small, compact portable part minimizes, making it space-minimizing, the efficiency of being able to receive these results immediately by simply using Bluetooth. Having less equipment, just the X-ray Gs themselves, something to examine like a part of a human body, and being able to connect them through a device like a computer, an iPad, any technology that you'd be able to review the pictures afterwards with your patient. The X-ray Gs are eco-friendly compared to X-ray machines that use X-ray film from examinations, which become hazardous waste after use. Doctors and patients would benefit from the X-ray Gs, creating a faster mechanism to be able to identify injuries. Athletes and sports teams would also be able to benefit from the X-ray Gs, knowing whether or not there's an injury immediately after the accident, especially in something like the head, like concussion, and determining next steps and protocols to take. The glasses, being portable, can help many athletes on the go by being able to do an examination immediately after the accident, like I said, from a sports professional or a physician, which is an extremely valuable advantage for the X-ray Gs. The idea of the X-ray Gs kind of just came to me, but the part of being able to identify the advantage of detecting concussions came from me having 2 previous concussions from my volleyball sport that I play, because it's just such a complicated process, and it's really annoying not knowing whether or not there's something wrong inside your head, like a concussion, and just having the time off. So there was certainly that behind my reasoning for choosing the concussion part. Not too many difficulties were encountered when creating my glasses, other than trying to create electromagnetic radiation, which was simply not possible for me to create. I was trying to create that for my prototype to make it more advanced. It simply wasn't possible around this time because I didn't have the materials and I wasn't able to create scientific energy like that. When making the X-ray Gs, I enjoyed being able to make it feel real life, and being able to invent something that hasn't been invented, using my own ideas and just my own imagination. So I thought that was really fun. And I made the glasses at home and at school with the support from my grade 8 teacher, Mr. Mifsud, an amazing teacher, extremely helpful and supportive through the whole process of me being able to create these. Some next steps I would take, obviously start investing into the X-ray Gs, putting more money into it, and kind of researching more about how the concussion part would be able to function. So simply putting more research into the technology behind all that and having more reasonings. Yeah, that's my project on the X-ray Gs. Thank you for your time.